So just going over your projects ahead of time. So for you guys with just the pocketbook project, and hopefully it kind of made sense for a pocketbook project. So this pocketbook project is really for you guys and for your own studying as well. So when we are doing, each individual week, taking everything that we are learning each individual week and taking what we learn and utilizing that pocketbook for putting really important information that you guys want to remember into that pocketbook so that you guys can refer back to it for currently now when you're studying, and then also for a means for when you are in practice as well. So something to bring with you when you are in working. So for anesthesia purposes, for doing physical exam stuff, for parasitology, for hematology, that type of stuff. So this is something to be able to refer back to long-term wise as well. So don't get too wrapped up into how beautiful it needs to be or anything on that realm of stuff, but really just getting that content down so that you are able to utilize it during this time. You can always make it look beautiful down the road. I've already heard from many of you already where you've got some plans in place where you're going to be typing things up and putting it down and that kind of stuff, so which is great. If you're part of the Facebook group for the crash course as well, reaching out to the people who are already currently in the course that are ahead of you guys right now, feel free to ask them kind of how they're currently formatting it out. You can also do that. And then I do have a couple projects that I have put in like a small little video just so that you get an idea of kind of what I have had students do in the past, might be helpful too. And again, if you have questions, don't hesitate to reach out to me, and I'm happy to help guide you additionally for that. Any questions on these like little tiny things? No, everyone's so quiet right away. Sorry, my dogs are like ready to party right now for some reason. And then lastly, before we just start, some of you have already jumped into taking some of the quizzes and stuff, and so taking the quizzes, I've given everyone the opportunity of just getting the answers right away after taking the quizzes, and so giving you guys that freedom to get those answers right away has given some individuals the opportunity to, rather than actually take the test first to see how well they're going to do on those tests, they'd rather just get a 0 on that test just to get the answers, which kind of defeats the purpose of actually taking the test for themselves rather than just get the answers. So I've actually changed it back to how we've had to structure it, just like in regular school. So again, where some people have to ruin it for others, to now where I have to release it back to everyone individually. So I apologize for having to do that. But I do want you guys all to try your best to take these quizzes. It's fine to, in the VTNE prep crash course, to take it with your best ability. And if you fail it, you fail it, because I'd rather you guys take it and know right away where you guys need to study. And that way we know where we need to work on things, right? So don't worry about, that you have to get 100% right away, because you don't. Not everyone's going to know everything right away. That's why we're all here. So please don't worry about that kind of stuff. And then, you guys have multiple attempts to take these quizzes so that you can then look at the answers research them, look at why these are the wrong answers are the wrong answers and why the right answer is the right answer. And we get together and talk about these individual questions and why they're the wrong answers and the right answers, and then how we can better take these tests too, so we can all get better at them as well. So hopefully by the end, you guys can kind of see why I give you that freedom normally to be able to just take the quizzes individually and then just get the answers right away without feeling like, you have to have that structure a little bit. I like to give you guys that freedom and not have to take it away. And so hopefully we can get back to that at some point. So, but until then, we're gonna kind of structure it this way. So, great. And then someone just posted, where do I access these quizzes? Perfect, great question. So these quizzes are on our Moodle platform. So this is where you guys get all of that content material. So you should have received an email from me with all of the information on how to access Moodle from our VTNE prep crash course site with the Moodle cloud, and then your login information for that. And then there's going to be coursework for each week that you have. So, and if you have not received or if you did not receive anything or any, if you need help trying to access that, just let me know when we can kind of go through that afterwards as well. All right. Great. So it looks like quite a few of you went through some of these quizzes this week. And so I want to kind of open it up to you guys to see who had any questions right away going through before I kind of opened it up on my end to see, where we wanted to start. But anyone have any questions that they had starting out?
I am still having trouble with the constant rate infusion stuff.
Yes, absolutely. That is a common theme thing. So I'm sure there's many people in our group that are going to need help with that, and that's on my list today. So great one to start with. So yes, we will definitely do that one for sure.
When we did them together before, when we were doing them together, I could do them, but then I thought I could do them, and then I got them wrong. I'm like, well, then I guess I can't do them still.
No, and it's been some time. So, yeah, we'll definitely do that one together. And I always, and that one I threw 3 of them at you at the same time. So it's like, oh gosh, I don't know if I can do this, 3 at once. And so we'll take a peek at that one together today. So, yeah, that's perfect. So Jessica, she just wrote it. Do you prefer us to wait to take the quizzes before the meeting or before? You haven't taken any of the quizzes yet. So great question. So each week, it is perfect for you guys to go ahead and do the coursework ahead of time. So that's kind of why I gave you guys all of the content starting on Monday. So you guys had the week to kind of work through the content and get through everything and taking those quizzes. That way we had time to be able to look at everything and see what questions you guys have. It's a little bit different now because you guys have gone through school. And so technically per AAVSB, right? They say you guys all, since you've graduated from school, you know everything and are ready to go in and be a certified, credentialed, registered, licensed technician, right? And so whether that is true or not, or you need some extra help is why you're here. And so this is why I say, let's have you go through the material each week, see what you know, and see what you don't know. And it's okay if you don't know certain things and you go, oh my gosh, like, I don't feel like we ever went through that in school. Or if we did, like, did we really go through that in detail? And it's okay to get things wrong on the tests and be like, I still don't understand it. Can we go over that again? Because that's then why we have these great conversations, because then I can explain things, and sometimes I might not explain it a great way where maybe someone who's in practice that is a peer can explain it really well to you, and we have a really good group dynamic conversation. Especially by the end, we're all having a really great conversation about certain things, so it gets a lot better. Angela said, I graduated February 2020 from Penn Placer. I do not work in a clinic. A public school. I'm a public school teacher. Good job. I'm much afraid I've forgotten so much. So great job being a public school teacher. My husband's a public school teacher, so I give you mad props for that. And I come from academia as well, so it's definitely very hard. And you know, yeah, it definitely feels like a long time ago, especially with COVID and everything. But I'll tell you what, I went to school. I shouldn't date myself, right? Um, but I went to school in 2000. I started 2005 and then graduated 2007. And I'll tell you what, I have never worked large animal in my life. And you guys really try me on some questions and it comes out of somewhere. So you may have thought that you forgot certain things, but it's there. It's just you got to exercise it, right? You got to exercise that muscle right here. And you know, as a public school teacher, you got to tell your kids to exercise it. Um, so yeah, the more and more that we practice it, the more and more you guys find better ways of studying that are fun and that you enjoy. 'Cause studying's not fun. That you're just going to get better at it. And you'll get ready faster for it. So tips of remembering classes of drugs, absolutely. So again, finding really fun ways of remembering them in funny ways is great. So like anesthesia and analgesia drugs are like my favorites to remember because I taught anesthesia for a really long time and surgery for a long time. Pharmacology we can have fun with too. I have some really great videos of Pictonics of how they kind of make stories in ways about certain drugs. And I kind of do the same thing. This is kind of why I like the Pictonics guy because, well, first I was like, I feel like I want to be his best friend because he's kind of fun. But yeah, just kind of making stories about where kind of these drugs belong to. And I always talk about big sister, little sister drugs. You know, some drugs kind of work in the same category, like, you know, diazepam, midazolam, they're in the same category of being benzodiazepines, but one works much longer than the other. So they have better characteristics than the other, pros and cons, of course. Diazepine, right, which we all know is Valium, it takes shorter period of time to work. So I always call it the sprinter. You know, I am not a runner by any means, okay, but my husband is. So I call it the sprinter of drugs. So it starts up really quickly, but sprinters, as you know, they can't run long distance. They're short, and that's it. But they're fast acting. So, but the diazepam only works for about 20 minutes. That's about it. But midazolam, it's a cross country runner, right? So they're in the same category as a benzodiazepine. So that's a midazolam's a cross country runner. So it takes a long time for it to start up working. And it takes about 40 minutes for it to actually like stop working, right? So it's that cross country runner. So it lasts longer. Now, there's other pros and cons to using either or as well, so we'll go into details about those drugs too, but, like one binds to plastic, as you guys might remember, right? And one you can give IM and one you can't. So kind of recalling some of those things as we talk about that, but it's like trying to get the key to, okay, how can I remember the things by calling one thing a cross country runner and a long distance runner, and then remembering the things of what your teacher talked about of, oh, one binds to plastic. It recalls certain things as you go through. So you do tend to remember certain things. We'll talk about alpha 2s as well, which I had the life of me trying to remember that when I was in school, I remember, but now it seems to be super easy, which alpha 2s are. Does anyone remember what alpha 2s are? Like alpha 2 agonists. The nice thing is they have a reversal. So.
Are you talking about?
Jessica O'Sullivan just said it. She said dexdomitor and xylazine. So dexmedetomidine, good. And xylazine. So Courtney, do you know, since you just spoke, I put you on the spot, do you know what the reversals might be? So the antagonists?
Well, I know for dexdomitor it's anisetin.
Okay, perfect.
Xylazine, is it?
It's my favorite drug ever. But you
oh, Yohimbine.
You know what my favorite drug is?
Yes.
Amazing. I didn't know you knew that. That's awesome. Yeah, so Yohimbine. So how we can remember that. So everyone remembers anisetin, but it's antipamazole, right? But it's hard to remember that. So we were so mean. So we had a student and she could not ever say antipamazole. And her name was Pam. And we'd be like, but your name is in it. How can you not say antipamazole? so yeah, just remember that it's antipamazole. And then we would be like, it's the Pam drug, so yeah, no, that's perfect. So a way to remember which one goes with which in those is that dexmedetomidine and antipamazole start in the beginning of the alphabet, right? And then xylazine and yohimbine are at the end of the alphabet. So that way hey, they're pairs together. And then agonists are like the teenage kids who just want to sleep in, and they just are, on the weekends, they're just really, I want to sleep in all day, right? So dexmedetomidine and xylazine, they make you go to sleep. And antagonists, like think of the little kids that antagonize the teenagers and then they just wake them up. And so antagonists are your yohimbine and antipamazole that wake those guys up to make them stop working. So you're absolutely right. So perfect. So those are those drugs. Now, when it comes to other drugs like anticholinergics and stuff on that realm, we have other drugs that kind of fit in those categories too. So obviously knowing the main ones are really important as well. So we talk about first, you probably think of, your anticholinergics. The big one that we use quite frequently, right? What's the biggest anticholinergic we use a lot? Atropine, yes. So atropine we use a ton, yeah. So We use it for like CPR aspects of things. We use it for in surgery if we need to. And we can insert the whole idea of sprinters versus cross-country runner in this area too, because we have another one that fits this category too of anticholinergic as well. So what's another anticholinergic that we use that is very similar to atropine? Not necessarily, it's not epinephrine. We use epinephrine with atropine a lot, especially in CPR, and it helps with heart contractility. Not lidocaine. Those are a part of our naval drugs for sure. Glycopyrrolate, good. Look, can you spell it all nicely too? Awesome, good. And so we'll talk about epinephrine and lidocaine in a bit, because those guys are really important for like when we chat about you know, our naval drugs, which you guys may know and remember of like the importance of those guys. But glycopyrrolate is also the cross-country runner or the sprinter in this case of our anticholinergics. Does it last longer, or is it a short acting? It's the cross-country runner. Very good. Yes. Yeah. So in this case, it's not going to work right away on our patients. It takes a little bit longer to work. But it lasts longer. So say you are going to be doing a longer procedure on your patient, like surgery patient. Sorry, Pomeranian. And so you will need to, if you're doing a longer procedure on your patient, you will probably want to use what type of drug? Which one? I'm gonna get you guys to talk because you're gonna get so tired of typing drugs in.
For a longer procedure, you'd want to use the glycopyrrolate.
Perfect. Perfect. Absolutely. Great. Yeah. So for longer procedure, you definitely want to use your glycopyrrolate over atropine, right? Because it's going to last longer for your procedure. And if you're giving that ahead of time, you're definitely going to want to utilize something that's going to last longer. Now, what if you have something that's crashing and dying, and you need something that's fast acting and wanting something to work ASAP? What do you want to use? Atropine. Yes, absolutely. So yeah, we try not to use glycopyrrolate because then we're gonna have to like watch our, you know, check our watches and be like, all right, when's it gonna kick in? So yeah, we'll try to utilize something like that. So so yeah, we'll definitely utilize something to that realm. Now, if we have a procedure that's going to last longer, and say we're having blood pressure issues, and we are, you know, maybe our heart rate's like a little bit low too, but we know it's going to last longer, we still need to probably give atropine instead, because we need something to work right away versus that longer procedure, and then just base it off of that too. So it is very case by case, but we need to address an issue right away. So perfect. Oh goodness. So kind of looking on those realm of things, and I believe I posted in there, especially for certain certain sorry about that. I just wanted to get my dog away from that area so he stops barking. So I believe I posted a few things, especially for this next week coming up, for anesthesia drugs. So anesthesia drugs, analgesic drugs, for you guys, and there'll be some charts for you. So if they're not in the pharmacology section now, they'll definitely be in anesthesia section. So you guys will be able to utilize and see those and just how they're charted out for you. And they have like little tips of how to remember those drugs. And so that should hopefully help kind of narrow down a lot of the drugs, bless you, on how you utilize those. It's okay. I see it, it's crazy how we see each other nowadays. So, so yeah, I mean, that narrows down quite a few of the drugs that we're able to utilize. So when we talk about antibiotics, though, antibiotics are definitely a lot harder to be able to kind of narrow down. And so we do have a few antibiotic videos that I kind of brought down to show you guys of broad spectrum antibiotics that we do use. And some of the broad spectrum antibiotics that we use nowadays, we use for many different purposes too, which can make things a lot harder for you guys. So, but just kind of getting a concept of, okay, what are the big purpose for those things? So, as you guys use the like I said, the floxins, right? The enrofloxacin, and then, the metronidazole type of drugs. We use these guys for so many different purposes too. They're not just used for, just treating bacterial infections in the body, but they're also used for, as you guys know, antidiarrheal for, for metronidazole purposes too. A doxycycline for one thing, I should say. Doxycycline we use for a ton of different things, right? We use for an antiparasitic, for, on red blood cells for many different things. We use for upper respiratory infections for everything, it seems like. We also use doxycycline for Lyme's disease purposes. Gosh, we use it, I don't know. Good thing it's not it's not as super expensive as it used to be. We also use it for heartworm treatment now, right? So I know we're kind of getting ahead of ourselves with heartworm treatment, but what is the reason we use it for heartworm treatment?
Doesn't it kill the bacteria?
The bacteria
worm?
I'm sorry, the bacteria for the worms, you said?
Yeah, isn't there like bacteria that it's supposed to kill in the worm?
Yes,
Okay.
Absolutely. Yeah, great. So yeah, we do like a 30-day course prior to even doing the the first heartworm treatment. So yeah, but it's really important for us to know what that whole treatment protocol is about, rather than just being like, oh, we just do it to do it. So, but there's so much that just our antibiotics alone are able to do than we even imagined as a broad spectrum antibiotic. When it says broad spectrum, that truly means like it does a lot of really cool stuff. So, oh, good. Look at you. The bacteria that surrounds it. Awesome. Good job. So yeah, I mean, so really looking at the root of the word is going to help you, especially in your antibiotics and knowing where they belong, right? Like your floxacins, your cyclines, right? So they all kind of fit in those same categories. So that is going to help, especially with your, with categorizing your antibiotics. And just knowing too, once you guys have a control over like those basic drugs, that is kind of what the VTNE asks out of you guys, especially for pharmacology. They're not looking for you to know all 8 million different drugs that are out there on the market. and everything about them and all the side effects about it. But you guys know where to go to find it, right? So you guys know how to go to dilute it all, and you're gonna know how to do the math after you're done with me, and you're gonna know how to know if there's a contraindication, because you're gonna know where to find the resources for it, right? What's your favorite resource to find all of this information?
Plums.
Yeah, Plum, right? Plum's like the best. Whoever, yeah. I wish I were the creator of Plum. Right? So I don't have that much info to be able to do that kind of stuff. So, but no, like be able to utilize Plum, or if you have Plum like as a book, or if you use it on your phone. I have it on my phone now, which personally it's just a dream. So if you have been able to utilize it, like through like your school having that access, it's like $5 a year to be able to utilize it. It's well worth the $5. And then yeah, your drug label, the insert that it comes with is fantastic to be able to use. So being able to read the inserts and know how to dilute things is really, really important too. So great. Okay. So we'll get to you guys. I do have some other things too for pharmacology that I'll give you guys as well to help you with categorizing your drugs as well. So I'll give that to you guys in Moodle and share that to you too. That's a little bit separate from anesthesia. I just remembered I can share that too. So you will have extra stuff. Of course, no problem. Great. So any other questions before we get into CRIs or anything else that you guys came about as you work through some stuff? Nothing. Everyone's still trying to figure things out as they go through. Seems. I'm sure you guys will have a long weekend to jump through and get a lot of this stuff done if you're not working and doing all that type of stuff. So, yes, good. No, so definitely pace yourself and try to do, assignments and stuff. I say assignments, but try to do things here and there as you go through. If you didn't already know, there is a Moodle app that you can utilize for your phone. So that may be helpful to you guys if you are on the road and not driving. So that way you can take quizzes that we have, and then watching videos or replying to as we have discussion boards, that kind of stuff too. If you are at work and are on your break and can't bring your computer with or something like that, you can get some of that stuff done while you are just out and about. So you can use that. So yeah, any tips on how to study pharmacology without feeling overwhelmed or having an anxiety attack? Truly, it's just studying little by little and just practicing repetitively over and over again and finding ways to make it fun. I know it sounds really weird, but make it fun. So when I was teaching anesthesia and stuff, it was a lot of repetitiveness and joking about how I was watching ER at the time, and on ER last night we just saw them having OD on diazepam, and then what did they treat with? Can you guess? They actually did it correctly, but it just reinforced the fact that oh, we're talking about these drugs over and over and over again. So even though you don't have to always feel like you're reading a book all the time. And so I think that you guys always feel like I have to be staring at a book to be studying appropriately, but it's not really like that. It's having a conversation. One girl that I know that was in my crash course, she was so funny. She would walk her dog and she would talk to her dog about what she's studying about. And so she would just be like, oh yeah, today my dog learned about da 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 da. And so you know, it's just her like practicing what she's just learning about, but it's her in her mind just saying, okay, I am reinforcing the things that I want to remember in my head over and over and over again. And her dog just became really a lot smarter about it all too. Um, so, um, yeah, and making again, like the flowcharts are really great. Like I said, I have a few of the flowcharts which are really fantastic to be able to do, and it's truly like making. And so what my class did was they made the flowchart essentially on the dry erase board, and they wrote out like the things that made them remember the drug, and then I just made it into a pretty flow chart for everyone else to use long term wise. So it'll say like ketamine makes cats crazy, and it says like cats in capital K crazies, so that they know that it's ketamine that makes them crazy. So stuff like that. Yeah, if your doctors like to quiz you, that's great. You can even quiz your doctors back if they'll let you, on things that you just learned, right? So not to say like, oh, you're quizzing your doctor, but like quiz them on things like, you know, hey, did you know, in nice ways, but like, hey, I just learned about X, Y, and Z. Did you know that da 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 about this drug and this drug? But it makes you say it out loud again. And then they might, counter back with something else about it, which rings a bell again to you. So real life situations are perfect to be able to, especially for people who are in the field, to connect those pieces. So I definitely was a person who worked in the field prior to going to school. And so I would take what I learned from school and would practice right after school. I was very lucky. I worked nights, like overnights. So I would take that and then, go overnight and practice like all of the things I just learned. And it just like made it all connect, all those pieces connect a lot more. So I think real life situations are really good in trying to connect those things. And we'll try to do that as much as we can while we're on Zoom, which can sometimes be hard. But I'll give you guys some videos that are real life situations as much as we possibly can, and do that via Zoom as well. And they might not always be pretty. So I do that a lot with students and say, do you think that's good? And then why do you not think that's good? Or what was good about them? What were things that you may have done differently? So, and it's still a really great learning opportunity. So those are all really good things. Pharmacology wise too, like what are certain pharmacology drugs that you would use for what certain patient, and why would you use that? So real life situations in those like circumstances, so just practicing those drugs, and why those are good. And yeah, I mean, anything on your level that you don't necessarily, again, have to read those textbooks, but looking at the flow charts and practicing where those drugs actually go, and then saying, okay, practice, practice, practice. What in that category again? What about that drug again was so important about that drug, or what makes that drug so cool, or, trying to make each drug cool, or fun. But yeah, we'll try our very best. I mean, we named all of our rats at school off of anesthetic drugs, so we won't be able to do that here. I won't be able to be like, hey, we got a bunch of rats, and we'll be able to name them all after drugs. Great. Any other questions? I know pharmacology is a whole new language, so that's what makes it really hard, is that we all struggle because we've never heard of any of these things before until we've gone to school. So we can kind of get through other things because, you know, we've heard of some stuff prior to, but we haven't really heard of pharmacology things unless we've gone through some of it. So awesome. Great. I am going to share my screen with you guys. And all right. So we were talking about these guys here. So I am just going to get rid of my answers. So you don't see them. Pretend they're not here. And so we're gonna look at this. And I'm actually just going to change some of these to different. Oh. Okay. So I made a new problem for us to be able to do. So this was the one that Sarah brought up for CRIs that we all definitely need some work on, I'm sure, on how to be able to calculate constant rate infusions. So if we are assembling a constant rate infusion for our patient who's 54 pounds and their fluid rate is 150 mLs per hour, and there's 750 mLs left in your bag, how many mils of each drug are you going to add? So with all of that information that you're given, so I will say on the VTNE, you'll probably be given just one drug. So I definitely am one of those type of people that will give you more of a life aspect in this regard, because many times you guys get an MLK for a patient, right? So you'll get, you know, this ready for a patient for surgery or something. So, and there's nothing wrong with doing a little bit extra work in this regard. So, but for purposes of the VTNE, just so you're not freaking out, you'll probably only just have one drug to figure out. So it's not too bad. So what would you do for a first step process here? And it can be small.
Convert the pounds.
Yeah, convert your pounds to kigs.
Yes.
Okay, perfect. So what would be your kilograms? Great. So we have a patient who is 24.5 kilograms. Great. So knowing that, what is our second step we'll look for? So we've been able, in this case, these are our dosings right here, right? So we've been able to fill in the kilograms. Awesome. So we can change the hours to minutes, absolutely, if you want to do that. We can leave the hours as well, if you'd like. You're on the right track. We need to figure out, though, time, right? So all we need to do in this case is figure out this last section, right? Beautiful. So we have 750 mils left in the bag, and our fluid rate is running at 150 mils an hour. So that gives us how many hours we're going to have left, right? So if we take 750 mLs that we have left in our bag, and then we divide that by 150 mLs per hour, it'll give us how many hours we're going to have left, correct? So how many hours are we going to have left? Gives us 5 remaining hours. Awesome. So kind of on Carly's thoughts here was now we need to kind of find out, because 1 is in minutes, right? So we do need to find how many minutes though we also have, just to at least figure out the ketamine as well. So what do we do for the 5 hours here? How do we figure out minutes in hours? Yeah, 5 hours times 60 minutes, right? And that gives us 300 minutes total. So now we know how much time total we have to be able to figure out any of our formulas here, correct? So we have all of the information we need to be able to solve these three CRI problems, essentially. Everybody with me so far? And everybody's with me so far with liking the fact that all of these are in milligrams as well. You don't want to have to switch them. Great. So now we just have to insert the information. So morphine, we have 0.5 milligrams times 24.5 kilograms times 5 hours, right? So if we do that math, that would give us what? $61.25. Now, not mils at this point, because it's still going to give us milligrams. We'll still have to figure out the mils by dividing out our concentration, because we haven't really gotten rid of our milligrams yet. No, you're good. So from here, that's where we have our concentration here. So that's kind of what I meant by our parentheses in there. So all we do at this point for that though is, how do we figure out our concentrate, or putting in our concentration then from our total? Divide by your 15 milligrams per ml. Very good, Jessica. Other Jessica, right? Jessica and Jessica. You guys are working together. So divide that by 15 milligrams to get our mils. And how many mils do we get for your morphine? I'll have to write that separately.
4.1.
Awesome. Morphine equals 4.1 mLs. Beautiful. Great. Great, so let's all try to do the second one by inserting it all in there. So don't forget, this one is 300 minutes. Great. So Casey got 1.3 mLs. Everybody else? Carly got it. Yay! Good job, Carly. Same answer, Jessica. Good job. Same answer for Daphne. Good job. Daphne, you made it after work. I'm glad you're here. You got it too. Good job, Megan. Busy day. Oh, goodness. It must have just been hectic for everyone today. I should say it's just been busy for all of you guys today. Or not today, but just in general. So every day's busy for y'all. All right, so everyone on the same page here. So 0.018 milligrams times your kilograms. So 24.5 kilograms, and then times your 300 minutes, because we're in minutes. And that gave us 132.3 milligrams. And then we divide by our concentration, which is 100 milligrams per mil. And that gave us our total of 1.3 mils total, because we're just going to leave it in whatever we can draw up. Great. Okay, so our last one, I'll let you guys try to figure this one out with a concentration, if that works, and we'll kind of go from there. Carly, you can totally do that with the minutes as well. Yeah. Actually, you might not be able to. Hold on. I lie. Yeah, you won't be able to with Carly because it's going to change. Even though your hours and your minutes equal the same thing, when you're doing it separately, if you just take 300, you multiply it by 300 versus 5 hours, you're taking your 0.5 milligrams of the top one, right? 0.5 milligrams times kilograms. And then rather than multiplying by 5, you would then essentially say, I'm going to multiply that by 300 for minutes, which is not going to be the same answer here. You would have to then divide by 60 again to get you back into hours. So that's going to give you a little bit different of an answer. That's why. Okay. But I got your point of what you're trying to get at there. So that's why at first I was like, no, that's totally fine. But no, unfortunately you can't. 5 hours. All right. So let me catch up to you guys really quick. 24.5 times. Awesome. So yeah, looks like we're all at 24.5 mLs. Good job. Okay, so now's the question. How did you guys get 2% to a concentration to divide? Other than looking at what I have here. No, just kidding. Because you guys got the answer before me, so. What is 2%? Casey says, my professor told us to drop the percent sign and add a 0. Yeah, they sure did, didn't they? That's the easy way to do it. That's for sure. So that would be a good way to know how to do it. Like if you are in practice and you need to do a constant and like divide something out really fast, you know, and get a answer right away. But like, what does 2% represent? Wow, I wish mine had told me that. Oh, Jessica. What is Jessica O'Sullivan? What did your teacher tell you?
They taught us the long way out, which I can never remember, which is why I hate percent concentrations. I've memorized that lidocaine is normally 20 megs per ml because I use it pretty regularly. So
okay, perfect. So if I were to give you something different, yeah, because you probably use lidocaine a lot, or something along those lines. So if I were to give you, so the long way out, if I were to give you like, oh gosh, I'm trying to think of something difficult, like a 9.5%. How would you try to figure that out? Look, she puts herself on mute, like, I'm done. Jessica, come back to me. I know you know the answer. Jessica Prey, you're thinking correctly. Is like you're on the right track, but not really. So it means that there's a percent of drug in a solution. Yeah. So let's think of it on that realm of things. So what makes up a percent? Yeah. So how much can you ever have in a percent? 100%, right? Yeah, divide the percent by the volume of the bottle. Yeah. So even if the volume of the bottle is 10 mLs, technically the volume that you that they are making up to make up that bottle is out of 100 mLs, right? That's what this is representing. It's saying that because it's a percent, that they are distributing it into 100 mLs of solution to make it a 9.5% solution for you. So now you have to know the measurement that goes on top here to know exactly how much of the drug was put into that amount of liquid, right? So you guys know that this is usually most likely some sort of like sterile water or something to that effect, right? Sterile water or saline, usually some sort of, it'll say on the bottle. The nice thing is that it always says like this on the back of the bottle of what it actually means. So when you go to work and you look at lidocaine next time, it'll actually say this on the back. So this represents here 9.5 grams of your, whatever drug we have over 100 mLs of sterile water. Okay. So even if you had, a 10 ml bottle or a 20 ml bottle, and so that's all that's in there, it means that even though they only squeezed that amount in there, it still is made or represented in 100 mLs because that's 100% of a solution. So how you long-handing it down from like Jessica O'Sullivan was saying, oh, I always had to do that. That's because you had a great teacher who made you do it that way. We had to learn both ways. So that way in practice, you know how to do it both ways. The longhand way is you take how many milligrams are in a gram is 1,000, right? So 1,000 milligrams, right? So you multiply that by your 9.5 grams. So that's 9,500, right? So you have 9,500 now milligrams of your solution in 100 mLs. So we're trying to get it into milligrams per mil, correct? Rather than just saying, oh, we're just gonna drop the percent and add a 0, which in this case, you just take away the decimal, right? So it would be, I can't take away the decimal, it won't let me erase, which would here be 95 milligrams per mil. So if we did it this way, we have 9,500 milligrams per 100 mLs. Now we just simplify it down. You just cross out the zeros we're not using, right? So you cross out that 0 and that 0 and that 0 and that 0 because we have 2 on the top, or 1 on the top, 1 on the bottom, 1 on the top, 1 on the bottom there. So now we have 95 milligrams per mil, like 95 milligrams per mil. Does that make sense? So it's good to know where you're getting, awesome. So it's good to know where you're getting it from, right? So it comes from this whole shindig right here, where Jessica O'Sullivan goes, oh, I hate it. What does it represent, right? But in reality, it's nice when you're working in practice to be like, oh, it's so much easier to say, oh, mannitol is 25%. That means that it's going to be 250 mgs per mil because we just you know, add a 0 or multiply this by 10. That's another way of doing it, right? Multiply everything by 10 by just adding a 0. So you just do it that way. So it just makes things, especially when you're working emergency, like I worked emergency for a long time, it makes it go by a lot faster. However, for VTNE purposes too, they may give you something along the ends of choose the most simplified form for your 9.5%. And the most simplified form would be 950 milligrams per 10 mLs. And without you guys knowing what this part represented, and you only knew drop the decimal or drop the percent and add a 0, you may not catch that this is actually the correct answer, which is kind of a pretty simple question to be able to get right in some of these harder questions that take longer to be able to get as well. So, so of course, it makes it harder with a decimal in there and stuff too. So of course I wanted to make it harder for Jessica because I know she probably sees 5% pretty easily in practice if she's working with drugs and stuff. So I was like, wait, probably don't see 9.5% ever. So give you something hard. I probably could have done 9%. Awesome. Okay. So,
Great.
how about C1 V1 while we have a moment? How do you guys feel about those guys? Do you love them, hate them, can't get enough of them? Ooh, Jessica Prey loves it. She's like, I didn't really say that. Hate them, hate them. All right, so we'll work on it. Oh, Jessica Prey loves math. Awesome. Jessica, we'll hang out and do math together. We don't love math that much, so great. Yeah, we'll definitely work on math, and I always like having extra math people like me because that way, you know, the more math we can do, the better. So Daphne's like, I just struggle with CRIs. Well, we will always continue to do struggle. We will always continue to do CRIs. So don't you worry. They will continue to be the life of the party almost every week, it seems. So we'll keep practicing those. So yeah, percents throw you off. Yeah. So, you know, this one is kind of easy because with C1 V1, we can really get rid of the percentages. So you don't really have to worry about it. Which maybe like you guys might be like, what are you talking about? So with this, so you have a 50% dextrose and you have 50% dextrose and you need to make a 1.25% solution. And then you have 375 mLs left in your LRS bag. How much 50% dextrose will you need to add? So our formula here is C1 times V1 equals C2 times V2. So kind of how I like to set mine up is very elementary level because that's just how my brain works. And so what I do is I just put what I currently have on the C1 side and then what I'm going to need or going to end up having on the C2 side. So I know that I currently have a concentration of 50% of dextrose in my C1 side. So the 50% goes over here. And what I am going to find out is volume of one of them, right? So we'll kind of figure that out. Now, concentration that we are going to be making is the 1.25%. So that goes over here. And it looks like we have 375 mLs left in our bag of fluids. And so when we think of our bag of fluids, right? So sometimes when you draw yourself a picture, we have 375 mLs left. And so we want to make our 1.25% bag of fluids. So this is going to be our C2 side. And then over here is our little 50% bottle over here. And we don't know how much volume we will have over here. So because we don't know this volume over here, this is our X right here. And then our volume is this 375 mLs. So that guy goes there. Right? So in this problem here, this is our nice, easy algebra problem. So we do not have to turn any of our percents into a decimal or anything like that. You can actually, just like our other professors have said, just drop the percentage, okay, and do your problem the way that it is. All right, so you don't have to turn anything else any which way that you have it, and just go forth the way that you've had it. So if you do want to, if you are like absolutely adamant, like I really love turning my percents into decimals, you can absolutely 100% turn everything into a decimal on both sides and go that route, and you will still get the exact same answer. And that's completely fine, but you absolutely don't have to do it. You will still get the same answer. So now we just have to simplify our equation and then solve for X. So let's go ahead and do that. So we're going to multiply 1.25 times our 375. And we get 468.75. And then on this side, we have 50x. And then, so if we're here, we're going to solve for x. So how are we solving for x? Divide by 50. Very good. So we divide by 50 and divide by 50 here. And then our x equals 9.4. Yeah, 9.4. Good. 9.4 mLs. Perfect. So now a really important thing to always remember is that our total can only ever be 375 mLs, right? So just like earlier, when we said that our solution in this area was 100 mLs to get a percent solution, right? We started out with 375 mLs. So if we are going to add 9.4 mLs to this bag of fluids, what are we going to have to do before we add 9.4 mLs of our 50% dextrose to that bag? Take off the 9.4 mLs of the LRS, right? Yeah, perfect. Yeah, so whatever, and it sounds really funny because it's not really that much, but when you start making up like 5% solutions of dextrose to fluid bags, and so that ends up being like a full liter of bag of fluids. And so that's 100 mLs of fluids. It adds up over time, right? And so it does change your percent concentration that you have. So your percent solution for that, even though you say in the bag is a 5% solution, it actually isn't if you don't take off the 100 mils ahead of time. So how many people make a 5% solution and don't do that before they go ahead and do it? Honest truth time, right? Probably quite a few. And so it changes your percent solution to be somewhere around 4.8%. And so when you have a patient who is really in need of, you know, dextrose, and it's, you know, whether it's a diabetic or a patient who is hypoglycemic or whatnot, you need to have it regulated pretty well, so that we can keep a close monitor to it. So making sure we're taking off or notating exactly how much we're putting in, or if you really don't want to take off that much, you're actually making it a true 5% solution ahead of time. So any questions on that one?
Right.
So it depends on which dextrose solution that we are talking about. So dextrose, depending on what percent dextrose that it is, it can become hypertonic. That makes sense. Also dependent on the patient as well. Oh yeah, absolutely. But more or less it's going to be more based on the actual amount that's in the fluids. More, I mean, you're gonna have to have a severely for dextrose, you're gonna have something severely. So 7%, you're talking for 7%, that would be in regards to saline. So yeah, we're just talking sodium chloride and on 7% being hypertonic. But it also changes for dextrose as well. So yeah, it becomes a little bit wishy-washy on dextrose. When it's solely on its own, it's going to be a little bit different than when it is also like in additional fluids too. So, and depending on in what fluid that it's in is also another thing, because it comes in a ton of different fluids as well. So so yeah, you kind of have to like put them together and look at it, like when it's like 0.45% saline with like 5% dextrose, then you have to kind of be like, okay, now is it isotonic or hypotonic, hypertonic, you know? So it just really depends on which one versus picking a bucket. So it gets a little kind of crazy. I can find you guys probably a table. I know there's a table for sure in McKernan somewhere, but I can probably find the table for you guys to be able to point you in the right direction for that. Because dextrose gets really crazy. So, but that's a really great question. Awesome. Any other questions from you guys at this point? You guys are so quiet. Not like my other groups yet.
Hey.
Maybe it's because it's Thursday night. Y'all are tired, depending on what coast you are. East Coast, you guys are probably like in your pajamas ready to go to bed. Exactly. You're ready for bed, Carly. Oh yeah, you're probably ready for bed. Absolutely. Great. Awesome. So yeah, I mean, this is kind of you've been in your pajamas. Yeah, absolutely. I know. I feel like I've been in my pajamas since COVID started. So So yeah. Oh, I'm sorry. You're doing a great job, Jessica, for working and taking care of customers. So props to you. Awesome. I totally got what you meant, Megan. You're good. You're good. Great. Oh my goodness. Wow. Multi-talented for sure. Great. So yeah, this is really kind of the intro of this week. We definitely have a lot of additional things as we go through and as you guys find additional things. This is kind of a short week because you guys just started and on things. So, but you guys definitely jumped in and there's a ton that you are ready to jump in and ready to do. So that's great. It gives me an idea too of what you guys really want to work on as well. So every class is brand new and different, which is always nice. And gives me a fresh start on new things. I don't feel like I'm ever doing the same thing over again. So that's awesome. So our plan for this week is, finish up on pharmacology and getting stuff done, especially over the weekend. And then also taking a look at anesthesia week as well. I say the first 3 weeks are probably the hardest weeks to get through. There's a lot of content, as you guys know, pharmacology, anesthesia, and surgery are the first 3 weeks. So there's a lot of content, but they all kind of blend together. So just keep plugging away at it. Don't give up. You guys are going to do a great job with it. And then keep the questions coming. So if there's something that you guys don't understand or you have a question about, flag those questions as you come along. It gives me an idea like, hey, that this person has a question that we can go over during our Zoom lesson as well. And we can go over it. Or if you guys want to go over it too, then we can go over it as well. So definitely bring that up. And I will I'll talk about that too. So and so we'll discuss a ton of things about anesthesia and then math additionally next week. So we'll go over more again and kind of reemphasize again CRIs each week, because I know that's a huge thing for you guys, and then additional math things too. So each week we'll kind of practice the same things that you guys are really kind of feeling like you struggle on. And the more and more that you guys practice, the quizzes and stuff and checking out the videos, those videos really help. And it makes, studying a lot more fun, honestly, because you're not hearing me talk all the time, the better. So it's okay to completely bomb the pharm pre-test. I will tell you that my tests are a lot harder there than the VTNE. Other people have said that. So, but that's part of learning, right? To bomb things or to get better at them, right? It shows your personal growth at how well you're doing. So if you do not do well on a certain area, then we just go back and look at it and say, okay, where did we not do great at it? And then, what are the good or what are the appropriate answers for that? And why was that other answer potentially wrong? Sometimes we don't read the question right. We're really bad at taking tests too fast at times. Sometimes you just misread it. Sometimes you just didn't know the material all the way through, and that's totally fine. So this is all about learning how to also take tests. So there's a lot that goes to it. And I definitely take, I definitely play at your guys's anxiety parts too. So like when we do some of our Zoom chats as well, we will have some fun at it too and do some games, but I'm also testing you guys at the same time. So you guys do enjoy those Zoom chats too. So don't worry. But we play games where I'm putting you guys to the test on that level too. So, but it's all to make you guys read questions a little bit better, read those answers a little bit better, but you're also being timed at the same time. So you're getting used to taking time tests, but all in having a good time at the same time. So don't worry about it. That's your first time taking one of my tests. And a lot of my old students would also say that some of mine are doozies. So, but they all are also VTNE like questions too. So, or VTNE post questions, old questions. So, so yeah, but you'll get better at it. Don't worry. It's the very beginning. So, and then yes, I mentioned the naval drugs earlier. So good. And just a reminder on those. So we'll talk about these two in emergency critical care, but the general rule for those guys are when we are giving those dosing out, the big deal for those guys is that are your naval drugs. So naloxone, atropine, vasopressin, epinephrine, and lidocaine. So naval, NAVEL. Those guys, you can give those by endotracheal tube if you need to. Those are the only 5 that you can do. And those, we're dosing them out by doubling the dose if you have to give them by endotracheal tube. So that's the big deal when it comes to those guys. So I know that we talked about those a little bit earlier about that, but yeah, we'll definitely be hitting a little bit more on those guys when we get to emergency critical care, which is always one of my favorite topics to talk about. So good question. Awesome. Any other questions for me today? No, we did a lot for first time meeting. So good job, guys. Great. Awesome. Jessica, have a good night working. Everyone else who also is working, have a great night. Will, yes, of course. Yeah, I'll definitely be sending you additional math. Don't you guys worry. And you'll probably have math every week, so don't worry. Oh, good. Yeah. And yes, I will be opening up for you guys week 2 starting tomorrow. So look out for that. So you guys will not have to meet with me on Sunday. That is for my other group. So don't worry about Sunday stuff. Sunday is for you guys to work on all of your guys' stuff in general. So like study doing, your content work and everything like that. We meet on Thursday nights. So awesome. I will, Carly, you should have stuff. Check your spam folder for something that may have been sent to you a while back, maybe like quite a few weeks ago, whether it was like 4 weeks ago, something was probably sent to you for a temporary password, and then you do have a username as well. Otherwise, I will try to figure out a way of sending something back out to you, and we can chat offline too for you. But no, that's perfect.